The U.S. is taking major leaps in its coronavirus vaccination effort. More states are expanding vaccine eligibility as the nation averages around 2.5 million shots per day. Nearly 45 million people have been fully vaccinated, and the U.S. could soon have a fourth vaccine in its arsenal. But top health experts warn the U.S. is at risk of losing its progress against the virus as states relax safety measures. The head of the CDC says variants are still spreading and a decrease in new infections has stalled. She's urging Americans to, quote, hang in there a little bit longer. Meg Oliver reports.
Tonight, AstraZeneca announcing its vaccine is 79% effective in U.S. clinical trials and 100% effective in preventing serious illness, while only producing minor side effects. If authorized by the FDA, 50 million doses would be available in the first month.
Americans should feel fully confident about having this vaccine. We also know that it works well against the UK variant.
AstraZeneca also reporting there was no increased risk of blood clots found in the U.S. trial, despite concerns from at least 14 European countries that temporarily suspended use. This as the CDC warns variants could trigger another surge.
While concerning variants are spreading rapidly, we are at a critical point in this pandemic, a fork in the road, where we as a country must decide which path we are going to take.
New COVID cases are up at least 10% in 18 states and Puerto Rico, amid concerns over a rush to reopen. New Jersey not lifting additional restrictions anytime soon.
We are back to leading the nation in the spread of this virus. There is no magic wand I can wave to stop the spread.
Food delivery company DoorDash announcing today customers in select cities can now get at-home COVID tests with results available in 24 to 48 hours. Tonight, an announcement that students in L.A. will head back to class next month.
Some children may face a lifetime of consequence if they're not back in a school classroom sometime soon.
And in New York City, the largest school district in the country, relying on testing to safely reopen schools.
What do you tell the students that might be a little apprehensive?
The New York City public schools are the safest place to be in this city right now.
17-year-old Meryl Mashoum was back in class today for the first time in more than a year.
Every single day I'm confronted with the mental toll and feeling a lot of anxiety and depression. But I do want to become a normal high schooler again.
In addition to high schools like the one behind me reopening, gym classes also resumed today. And starting tomorrow, anyone over the age of 50 in New York is eligible for the vaccine. Elaine?
Meg Oliver, thank you. Miami officials are cracking down on spring break crowds, extending an emergency curfew for several more weeks. David Begnaud is in Miami Beach with more on the chaos that ensued over the weekend.
After a year of COVID lockdowns around the country, you might say the cork finally blew. This is what police say has been the worst of spring break on Miami Beach, where partying turned to chaos before police eventually moved in with SWAT teams. At times, there were skirmishes with mostly unmasked revelers. Police fired pepper balls to disperse the crowd, and they made more than 50 arrests here since Friday. By Saturday night, there was a state of emergency in effect and an 8 p.m. curfew for the city's entertainment district.
All sorts of things from just inappropriate conduct to full-out criminal activity, which has become a real policing challenge.
And there's a health challenge. Florida has the most cases of COVID variants than any other state, including that highly transmissible P1 strain from Brazil. And Florida ranks 5th nationwide in the rate of positive COVID tests.
Those statistics suggest that this is not a place that is, out of the woods by any means. And then you put in these crowds, and all of a sudden you have really something that feels like an emergency.
Meanwhile, the TSA is reporting 1.5 million people were screened at airports yesterday. That makes for the busiest travel day in a year. Back here on Miami Beach, it was dead today. The question is, what's tonight going to bring?
Every time the police will come around, we'll run to the next street. And y'all come again and run to the next street. So that's how it's going to be until we decide we want to go home.
Dr. Dara Kass joins me now. She's an ER doctor and medical contributor for Yahoo News. Dr. Kass, thanks very much for being with us. As we heard, a U.S. study found AstraZeneca's vaccine was 79% effective with no safety concerns. Now, the drug has not been authorized in the U.S. yet, but could international concerns over blood clots feed into vaccine hesitancy here? And how do officials overcome that?
So I think that's actually really an important point about why it's so important that the FDA in the United States review the data, and actually when and if the FDA issues the emergency use authorization, showing that the data is solid, that it's safe and effective, and that these blood clots that were anecdotal were not related to the vaccine, in fact, were not clinically significant, that will reinforce the safety and efficacy of this vaccine, even if we don't need it here in the United States, and we're able to send doses abroad as a real effort to increase vaccinations around the globe. That will show people that we believe confidently in this vaccine and overcome some of the hesitancy that the 14 European countries that put a pause on this vaccine have unfortunately instilled.
Well, the director of the CDC says she's worried we'll see another, quote, avoidable surge as states continue to ease restrictions. The U.S. is vaccinating about 2.5 million people a day. Do you believe, Doctor, this pace is enough to prevent another surge?
So it's not that the pace of vaccinations can prevent the surge. The vaccine is effective, and it's remarkable in its ability to prevent sick and dying, to become sick and die from this virus. So that's amazing. Unfortunately, we need to still do those public health measures, which means wearing masks, staying distancing, testing if you're sick, for patients that are unvaccinated. And that's the race that we have for these variants. We need to make sure that we do both things at the same time. And unfortunately, what Dr. Walensky was talking about is that we are seeing states lift their mask mandates and loosen those regulations. And now we're seeing in South Beach, obviously in Miami, that people are just using this as an opportunity to throw caution to the wind, even though we're not near anywhere we need to be for vaccinations to prevent any more spread.
Meanwhile, pockets of New York City are experiencing a surge in infections. The former head of the FDA is warning a variant first found in the city might be fueling these spikes. Doctor, remind us what we know about this strain.
So we know this strain is related to the South African variant. We also know that it is prevalent in new cases, but we don't know something that Dr. Gottlieb hypothesized, which is that people who are vaccinated are getting infected with this strain. We have not seen any surge of infections in post-vaccinated people that are 2 weeks past the 2 doses of the mRNA vaccines, Pfizer and Moderna, or 2 weeks past the Johnson & Johnson single vaccine. So for now, there's no cause to be concerned in vaccinated people, but we do want to remind those who are unvaccinated to stay masked and stay distanced, and for people that are vaccinated to mask up when they're in public places.
Well, coronavirus infections in the U.S. were going down for several weeks, but the CDC director now says cases have stopped decreasing. What's behind that?
So again, I think that a lot of this is related to the behaviors of those who are unvaccinated. The fact that people just are very tired of this virus, they fatigue over the public health measures. And when their governors lift those mask mandates and really open up businesses 100% without any a reference to how many people are vaccinated in the state, we're going to see a plateau and a leveling off at a steady state of what is really a high level of viral transmission. So we do need people to just stay the course a little bit longer, like Dr. Walensky said, and make sure that we can stop the spread in unvaccinated individuals and stop the spread of these new variants as they get into our communities.
All right, Dr. Dara Kass. Doctor, thank you very much.
Thanks, Blaine.